To me, I'm very, very passionate about trying to integrate the importance of behavioral health in every primary clinic that we have throughout Iowa health system, and we have really begun that in force here at Trinity.
The overall concept of the behavioral health program with Robert Young Center is to recognize that many physical illnesses and chronic diseases are impacted by mental and behavioral health issues.
And several years ago, what we did is we applied for a federal fund to help integrate services for the severe and persistent mentally ill. We put behavioral health therapists into their practice.
I'm Kathleen Loomis, and I've been a part of community support program for approximately 3 years. Well, first of all, I'm diagnosed bipolar, anxiety disorder, borderline personality. I have the mental health issues as well as I have the substance abuse issues, alcoholic, drug addict.
There are 3 primary objectives that we have related to the integration of primary and behavioral health care. One is we want to ensure good access to care, both behaviorally and physical, for both behavioral and physical issues. Secondly, we want to be able to reduce costs and associated utilization, such as using the ER or readmissions. And lastly, we want to ensure that we can produce good outcomes for the patients for both their behavioral and physical health concerns.
My memory is vague in how many times I was going in and out of the hospital before I became a part or a member of CSP. All I know is that it was every weekend, to every 2 weekends. If it wasn't for community support program, I would be one lost individual. I can't stress maybe exactly how sick I was, that I don't know that I'd be alive.
Literature will tell you that patients who patients with behavioral health problems go to a medical doctor, and there's less time spent with them, less tests ordered for them, and the patient goes and they come away and they don't understand anything that's been said to them. So by going, the nurses attending those visits with them, they're able to help patient then navigate the system and not have overlapping care.
The nurse, I call her Chris the nurse, she's my nurse, and we've worked together now for years. She sets up my meds because I overuse my meds, I underuse my meds, and I've learned the names of my medications, the doses of my medications. And that's pretty important when you're taking the psych meds and also the medical meds.
We provide patient-centered care by developing a treatment plan one-on-one with the patient. The patient chooses and identifies their goals, their outcomes, and the activities they're going to do to achieve those goals.
They've developed a program for me because I was high risk, and it's called RAP program. And what that is step work. Instead of calling and going right up to the hospital and having them call Dr. Ritterhoff, my psychiatrist, and admit me, they go ahead now and I call here first. I call my case managers and therapists. I come down here and try and talk it through, the problems that I'm having, instead of just jumping the boat.
We have had some national benchmark outcomes as a result of this. I mean, they're profound. For example, ever since the second quarter of 2010 up through the second quarter of 2012, we've had a 46% reduction in emergency room visits.
Our depression scales have decreased. We've had an 88% in the report of their quality of life measurement. We've had 98% patients have been screened annually for physical exam, which is significant amongst this population. We've had a 72% rate of dental examinations done.
And I would add, at the least expense, because this type of thing can reduce utilization. It can reduce primary care office visits by up to 25%. So in a shared savings plan, that goes to the bottom line.
This experience has just been a blossoming. It's a work in progress. I have my days when I'm down. I do not have as many days like that anymore. Something's going right.
It's a model that helps people live longer. It's a model that helps people live happier. It's a model that saves expenses. It's a model, quite frankly, that gives the best outcome every patient, every time.